Everyone. My name is Amanda Ingolinsky, and I work for Be Aware Blount Anti-Drug Coalition. And we are here today with Kristen Robinson, and she is a licensed alcohol and drug addiction counselor. She's also a nationally certified addiction counselor as well for the state. And she comes to us from Village Behavioral Health. And I'm going to turn it over to her for just a second to tell us a little bit about her role there.
Hi, like you said, I work for Village Behavioral Health, and I actually created the Thrive program. The Thrive program is thorough, healthy recovery in various environments, and it's based on the fact that your recovery shouldn't be dependent upon where you are. It should be dependent upon your mindset. So we teach adolescents who have co-occurring mental health issues, coping skills and recovery skills to help them be more successful at maintaining long-term recovery.
Okay. And we've started just kind of a series of interviews with professionals ever since the COVID-19 outbreak, because we really, as a coalition, want to bring resources to our community and specifically to our parents and parents of teens or children that may be struggling or have previously struggled with substance misuse. So the first question that I really have for you is if you could talk a little bit about what you're seeing with how children and teens are, how they're coping during times like these with this idea of fear, and how they could possibly even recognize that fear in their own bodies.
Right. Well, we all have physical warning sensations that they're natural to us. So you may bounce your knee, I may, clench my jaw or fist. So it's important to recognize the physical warning signs of you getting upset when fight or flight is kicking in. So any person can just be aware when they're upset or triggered to just record what they usually do naturally when they're upset. And just keep that in mind so that you can be aware if you start at the very beginning, so that you can implement some type of deep breathing or healthy coping skill to kind of interrupt it.
Are you seeing any of the kids that you're working with experiencing higher levels of stress ever since the COVID-19 outbreak sort of took off?
Yeah, since we're a residential facility, we definitely want to keep our campus, safe and COVID-19 free. And right now we are very successful and very blessed that it's not there. And one of the precautions that we put in place to keep everybody healthy is we have actually stopped family sessions in person and also off-campus visits with family. So we've actually started doing a lot more kind of recreational things, activity therapy, vocational therapy, and just doing a lot more, incentive-based things to kind of keep the kids on a more normal level, because they are missing their families. And they understand for the most part. The biggest issue is that they're still in school and they don't understand why they're in school while everybody else is out. But we try to explain it to them. And we're trying to keep it as natural as possible. But the main thing about fear is educating, whether it's a kid that's in residential or a kid that's at home. Fear is something that you have to learn how to deal with. And using drugs does not help you deal with fear. It actually helps you pretend it doesn't exist, and that's not healthy. It's very important that we understand that ignoring things is related to addiction. Even if you're not a full-blown addict, it's related to addiction. And so it's very important that we face things and we don't avoid them. And so we have to come up with healthy ways to cope and face things. And we teach through our own actions. And it's said that people can't hear what we're saying from seeing what we're doing. And so if we are kind of freaking out, but then we're telling them to stay calm, that's sending a mixed message. So we want to make sure that our actions are actually merging with our words.
Awesome. Why would teens turn to substances, alcohol or drugs during times like these?
Well, we all have our default coping skills that we turn to, and coping skills are not equal. Not all coping skills are the same. And if we tell somebody to use their coping skills, we might actually be telling them to use a negative one. So it's important to understand that we need to be specific when we teach coping skills and teach about healthy coping skills, positive ones. That all coping skills are distractions. There's just ones that help solve the problem, and then there's, ones that actually add to the problem. And the most important thing is not avoiding or ignoring, because again, that's really tied to addiction and addictive behavior. The main thing is you want to address or interrupt whatever is going on. And as a part of the Thrive program at the Village, we've created specific true coping skills that we talk about. And there's also true and healthy coping skills that we teach. And true coping skills are coping skills that you have access to all the time because they're mind and body based. While luxury coping skills are very important and awesome coping skills, however, you don't have access to them all the time because they're outside of you. And addiction is always looking for something outside of you to actually deal with things. So a luxury coping skill can be negative, but there are some very healthy luxury coping skills. Support and being connected is super important to recovery. And so that's a very important luxury coping skill. But the downside to luxury is it's not always available. So we created the different types of healthy coping skills, and we teach at the Village that not all coping skills are equal. And so we teach true versus luxury. And the way that we actually teach the difference is we tell the kids, if you can't use it in the back of a cop car while you're handcuffed, then it's a true coping skill. So, if the kid's saying, well, I play basketball. Well, can you play basketball in the back of a cop car? And they say no. So that's a luxury coping skill. The other thing that's really important to understand is we all have those default coping skills. And substance use is a very unhealthy one. And the reason why it's so unhealthy is because the brain actually likes the substance use way more than other coping skills because it's so effective. And the way that I talk about it when I speak is, if you're on a soccer field, in the back of your mind, you still have that fear, you still have that trauma, you still have that issue. If you're with friends, you still have that issue in the back of your mind. When you get high or you're using substances for the first time, maybe ever, the back of your mind has relief. And so because of that relief, triggers are created. And that's the crux of addiction, is the fact that the same part of an individual that makes them intelligent, that makes them kind, is also triggering them to get high when they're afraid. So it's really important to just understand that the brain creates a breadcrumb trail back to the drug that's a trigger. And we have thousands of triggers when we get high or when we do any type of addictive behavior that are very hard to cope with. So that's why you have to have those true coping skills that you have access to all the time.
Very good. That makes complete sense. If for our parents out there, how can they talk to their teens about their stress and anxiety if they're also very anxious or also very stressed? I think we're all dealing with atypical situations, whether it's our work environment right now or whether it's figuring out childcare or financial issues with COVID-19. How can parents manage their own mental health issues, even if it's just extra stress or anxiety, and then also attend to their child's needs?
Well, it's important to understand the biology of addiction, and you can kind of do like an elementary kind of basic, I can do a basic kind of education about that. So if you've used substances, it's important to understand that and anticipate the fact that your brain is going to trigger you to want to get high because the stress reaction. So it's important to have healthy coping skills. And if you're telling your kid to use healthy coping skills, but you don't have healthy coping skills, then that's going to be a disconnect that you're going to be actually teaching one thing while saying another. So using the coping skills themselves as a part of family therapy at the Village, we get the parents involved with the true coping skills, and we ask them to actually create tiny habits each week where they implement these healthy coping skills along with the kids. If the parent is really not okay with it and doesn't do it, that's very detrimental to the recovery and the treatment process, because parents are way more important, and because they're in the life all the time. It's important to have go-to coping skills on hand that are healthy, that you can use so that your default becomes more healthy and positive than negative. And the other thing that I teach all the time is don't be triggered by the same trigger twice. So make sure that, if you are triggered by something, if you are afraid, have a coping skill, a healthy coping skill that you use so that you could use it again in the future. And again, we can't avoid or ignore things, and we must face life on life's terms so that we're not changing perception of reality.
Do you have any tips or examples of things that parents can do kind of in the moment when it becomes frustrating or overwhelming?
Definitely. It's important to understand that healthy habits are just as hard to break as unhealthy ones. And so if you start to use healthy coping skills like 5 senses, which is a DBT, dialectical behavioral therapy skill, where you're grounding yourself, because the brain can really only focus on one thing at a time really well. So if you're anxious and you're stressed and you do 5 senses and you identify 5 things you can see, 4 things you can hear, 3 things that you can touch, 2 things you can smell, and 1 thing you can taste, that's going to be a little break. It's going to be grounding you to the moment so that you're not all up in your head and getting all freaked out and emotional. It brings you back to rational. A really good travel size, I call true coping skills that are easy to use, I call them travel size. Gratitude is probably the most workable, accessible, true coping skill that you can have access to. And it's a healthy distraction. It helps you focus on what's good about the situation, because there's always something to be grateful for no matter what. And then the other thing about gratitude is studies have shown that it actually boosts your natural brain chemicals, which is super important, because if you're using drugs, sometimes you've decreased your natural brain chemical production.
Awesome. Oh, I think those are great. And then as far as checking in, so we're checking in with ourselves as parents. How might parents check in with their teens around mental health or substance abuse issues, especially if that's not something that they're super comfortable with, or if this is a newer role that they're helping fill?
Right. So your kid better than anybody else. You know their baseline, and you know what's different from baseline. So just being aware with everything going on, you could really be distracted. Just pay attention. Number 1, pay attention, be aware. Ask questions. If you see evidence that something's not right, take note of it and then specifically address the evidence. And, don't jump the gun, don't accuse, because accusations actually make parents part of the problem instead of part of the solution. So have evidence before confronting. The other thing is you can say anything to anybody at any time as long as you know how to say it in the appropriate way. Give some thought to it. Be genuine. Don't try to act like you're not afraid if you are. Don't try to act like you're not stressed, because teens are very perceptive, and they can read you. And if you're kind of trying to act like you're fine when you really aren't, they're going to pick up on that. The other thing is have clear, concise, predictable rules set so that they know if something's amuck or something's amiss, that they're going to be asked about it. And so it's not going to be out of the blue. The other thing is make sure that you're trying to have more assertive communication rather than passive or aggressive. And a really good coping skill for that, a true coping skill, is having a safe word. And so you can pick a safe word. I've had ocean as a safe word. Anything can be a safe word. And it actually, having a safe word and saying it when emotions are running high, you stop the conversation for 2 to 5 minutes. And then what happens is that afterwards you come back together and discuss it. And then you're going to have more assertive communication. Because if you try to talk about it in the moment, that's when people become passive aggressive or aggressive. And that's when a lot of things pop off, as they say. So it's important to just have some rules in place prior to. And then the other thing, why parents should get involved and not just be enablers or let things go by, is that they are legally and financially responsible for their kid. Whether you're a guardian or whether you're a parent, you have to be aware of what they're doing, because ignorance is not an excuse. So that's one thing that it comes down to. If parents aren't, saying, oh, they're going to get through it, pay attention, because when it comes to legality and financial issues, it's definitely going to be important to face.
And I think that's perfect. One of the things that we talk about as a coalition is the importance of supervision. Not just young children, but for teenagers as well, knowing where they are, who they're with, if it's someone you trust or know well. Mm-hmm. So along those lines, kids are at home right now, mm-hmm. teens are at home right now, which means that everything that they have is in their home as well. Right. So if they do have substance issues, or if they've had a history of that, whatever it might be, what are some ways that parents can monitor their homes for that?
Just paying attention, understanding what's going on, taking note of it, and then making sure that you address it. And, a lot of parents are very savvy. They've been Googling things. They've been a part of treatment, whether it's outpatient or inpatient, residential. And just go with your gut, do things, reach out for help, reach out for resources, ask questions. Right now there's, you can't go and see people, but you can definitely still take the opportunity for telehealth, or also, just listening to an interview like this is very important. But paying attention and being aware and not getting caught up in the moment is the most important tool that parents can use.
Excellent. As far as things that they could put into practice for daily routine for living right now, because I know a lot of families, mine included, all of us, we're in close quarters every day. What are some good practices that families could put into place as a daily routine to keep the stress level down or to minimize conflict?
Well, as a part of addiction and drug use as a whole, it's important to understand that schedule is thrown away at that point. If you're using, you sleep during the day and you don't keep regular hours. So this is actually a good opportunity for a schedule to be put into a place, and then try to adhere to that schedule as best as possible. And I would definitely include the teen or the child in the creation of the schedule, and then have dialogue about, what works with the schedule, what doesn't work. And when you give them ownership, they take a lot more care in following it. So, it's important to understand that kids who use drugs, they're not bad. We try to stay away from words like good or bad, unless we're talking about like pizza or burgers. So it's important that people have healthy and they have unhealthy attributes, and everybody has something that they need to work on. I compare myself to a dentist when I do therapy, because you're in front of me and I'm all up in your Kool-Aid and all up in your business. And there's a bunch of good teeth I'm seeing, but there's a couple of really bad cavities that we need to address. And that's how we need to address individuals. And so have the kid create the schedule. And if there's an issue, talk about why it's an issue. If they're playing PlayStation 4 for 6 hours in the schedule, obviously that needs to be abbreviated, but let them have ownership, and then it's going to be way more successful.
Awesome. I think that's great. The last question that I kind of had was, we've seen, of course, a lot of issues with suicide recently in Knox County, and specifically, you know, as substance misuse and mental health issues are so closely linked, you can't really talk about one without the other. Are there any thoughts that you can share on that, or really explaining how the link between substance misuse and suicide kind of connects in that way?
Oh, definitely. And there's so many levels of linkage between them that I'm not going to hit all of them, but something that's really important is the fact that being high or using substances creates an unachievable lifestyle while sober. It's not going to be sunny all the time. And it's really imperative that we learn how to live life on life's terms, because if we do not, then when life happens and there's not access to substances or addictive behaviors, it's going to crush us. It's going to be catastrophic. And so small things that usually we can handle become very, I guess, difficult to deal with is an understatement. So it's important to just focus on the fact that we have to understand how to deal with emotions so that they do not cripple us when we deal with them. The other thing is that we don't want to be unprepared for situations, especially when we have kids looking at us. So make sure that you have your own way to deal with things so that you're not, by virtue of, a default unhealthy coping skill, teaching a wrong way. The other thing is, I learned this from a webinar called Machinery of the Mind in 2012. It was by Alan Barger, MSW. And at the same time that we're using drugs, what happens is that our brain actually decreases natural brain production, and we rely on an outside source for that feel good. After, if you quit using, or after the high, there's a rebound effect. And during the rebound effect, it's lower lows than the high, and it lasts longer than the high. And there is a huge connection between the rebound effect and suicidality and suicidal ideations, because it does take a long time for the brain chemicals to actually kick back on after such a high has been experienced. So it's really important. And if anybody wants to learn more about that, they can definitely Google Machinery of the Mind, Alan Barger, MSW, because it goes into a lot of details that I'm going to be leaving out today. The last connection that I want to kind of mention is depression and anxiety. When you don't have another way to deal with it other than ignoring it, when it does hit, like I said before, it can be catastrophic, and it can feel like it's just life altering where you cannot deal with it. So learning healthy coping skills can be a lifesaver. One of the main things is just to learn how to live life on life terms and experience emotions, and understand that emotions aren't quite as devastating as we think they are.
Very good. Are there any last kind of thoughts that you have as far as when we're talking about youth or teen substance misuse, when we're talking about parents coping, or, anything specific to mental health and COVID-19? Any final thoughts there?
Well, there's adages that I really like to use, and I don't know where they came from, so I can't give proper citations, but addiction costs more than you want it. It costs more than you want to pay and stays longer than you want it to stay is one of them. I'll say that one more time. Addiction costs more than you want to pay and stays longer than you want to stay. There's also another one that said, there's nothing so bad that addiction can't make worse. And I really like that one. And then my favorite one is recovery delivers everything addiction promises. And again, I can't cite where they came from. I believe they're all 12-step adages that ring true. And it just comes down to, you have to face things, because putting them off, they only get worse. It's the way that I explain it is, if you close the door on a leak in a bathroom and expect it to fix itself, that's the same thing as closing the door on your problems and not facing them. It's much better to do something than nothing.
Okay. Well, thank you so much, Kristen, for taking the time to speak with us today. We really appreciate all of your knowledge and expertise that you bring to this topic, and we want to continue to do informational talks in the future, definitely. Again, this is Kristen with Village Behavioral Health, and we thank you guys so much for listening today. And if you have any questions or comments, Carly, what else am I forgetting?
I think that's it.
Okay. All right. Well, you guys stay safe
Thank
out
you, guys.
there. Stay well. And we'll be talking to you soon.
Thank you.
Bye.
Bye.